Good morning, everyone. Welcome to Virtual Abilities 2025 Mental Health Symposium. Gentle is having technical difficulties this morning. Her power and internet went out a little while ago, so I have the honor to act as her backup. We hope you will enjoy your time with us today and that you will learn a lot about our theme, which is facing our fears, managing anxiety about life's uncertainties. Fear is a very powerful emotional reaction. There are many reasons we have fears in the modern world. I'm sure we all have our own private stock of things we fear. And no, there will not be a test. If you are not able to manage your anxieties, your fear can become a disability. Luckily, fear is a treatable condition. The broad theme of this conference allows us to look at the topic of fear from a number of different perspectives. I think you will find that much of the advice our presenters offer about the particular fears they work with are applicable to other fears as well. Now, a quick housekeeping reminder for this conference. Many of our presenters are new to Second Life. Please be patient with them. Hold your thoughts and questions until they are done presenting. They need to concentrate. Thank you. And now
Sorry, I'm butting in.
And Ziri will introduce our first session and our honored guest speaker.
Sorry, a quick note for everyone before we start. If you're not speaking, please turn off your voice, because otherwise it interferes with the transcription. Thank you.
Greetings everyone and welcome to Virtual Abilities 2025 Mental Health Symposium. I am Zui Avian and I have been in Second Life for about 16 years. I enjoy exploring the various regions and communities of Second Life. I also volunteer as an information assistant for the Virtual Worlds Education Consortium. In real life, I am an IT Quality Assurance Analyst from Malaysia. Today, I would like to introduce Dr. Manish Kumar Asthana. Dr. Asthana is an Associate Professor of Psychology at the Indian Institute of Technology, Roorkee. He is interested in cognitive psychology, fear conditionings, and the emotions of stress and anxiety. Today, he will explain how imagery-based interventions can attenuate conditioned fear. Audience, please hold your questions and comments to the end so as not to interrupt the presentation's timing. Welcome, Dr. Asthana. The floor is yours.
Thank you. Thank you, Zivian, for a nice introduction. I hope I'm audible and my voice is audible to everyone. Uh, this is my first time in Second Life, so please excuse me in case if I make any mistake. This is my first time at this interface, which is wonderful. So I will just come to my topic of today's presentation, so that the other speakers can have their time as well, and we can track record of the time. I ensure you that we will have enough time after the presentation to take questions, and I hope that I may provide some answers to your queries which requires immediate attention. Feel free to ask me any question. I will try to answer any question which is a question. Doesn't mean it has to be more critical or need to be more has to be more specific. Okay, so today what I'm going to talk about is attenuating conditioned fear using imagery based interventions. How can we attenuate fear in the lab setting, and how are we treating these fear? That is what I'm going to talk about. So in this presentation I will be talking about the fear and anxiety, what is fear and anxiety and how they are different, then imagery based interventions, and then a study which we conducted in our lab to demonstrate that how it can be treated and it can be used as an intervention and provide a novel methodology to the people who are suffering from anxiety or related disorders. Though this study we didn't do it with the clinical sample, but that is the following follow-up study which we are planning, and then conclusion and future direction, what could be done. So fear and anxiety, if I talk about, this is an interesting topic. I took this topic in the year 2010 when I started doing my PhD, and my supervisor was a psychiatrist in Germany, University of Würzburg. We started working on this topic because we realized that across the globe there are people suffering from anxiety and related disorders. Anxiety disorder itself is an umbrella term. Under this umbrella, there is a social anxiety disorder, generalized anxiety disorder, panic disorder, phobias, obsessive compulsive disorders are part of it. The other category, as per the DSM-5 guidelines and explanation, post-traumatic stress disorder is another type of disorders, and generalized anxiety disorders also has been seen differently. So when we talk about the fear, learning to fear in the environment is an essential for the survival instinct. It is a most primitive response. So what we do basically to respond towards the threat in the presence of the predator. So the most primitive response was fight or flight response, and to do so we learn that what is important, this distinction about what is threatening, what is non-threatening, what is fear relevant, what is non-fear relevant. It becomes crucial to live in this environmental setting. Each one of us has different understanding towards the threat, and that is why different types of threat, the responses become different types, and that is why we refer it not as a threat based fear response, which means threat towards fire will be giving a different response, and threat from dying in the ice cold weather will be giving a different response. Though in all these scenarios, the threat center, that is the amygdala, is going to detect the threat and alarms the individual that there is a threat in the environment and how one can overcome such kind of threat. So when we see the spider or when we see the snake, the threat-based response means this response towards the snake and the spider will be distinct from each other. However, the physiological responses may be similar in nature, may also have a similar intensity. This persistence of fear, if the fear is there, fear response is there, and if it is persisting for a long period of time, and in absence of these threats, these responses are still there, then it could lead towards the psychopathology. So the anticipation of threat is actually something which people have realized is the anxiety or worrisome condition. So in what is the distinction between fear and anxiety is that fear is the immediate threat response towards the imminent threat, while anxiety is the anticipation of the threat and the response may be similar in nature. So thinking about a spider when the spider is not present would be an anxiety, could lead towards anxiety. However, if the spider is present and then somebody is getting threatened, that is fear response. And this is fear from a spider is arachnophobia. Now, when we talk about fear, what we also understand with the fear is that dysregulation of fear is the root cause of anxiety and related disorders. And several researchers have reported that people who are suffering from anxiety and related disorder, they cannot regulate their fear. And this dysregulation leads towards the disorders such as post-traumatic stress disorder, panic disorder, phobias, obsessive compulsive disorder, generalized anxiety disorder, social anxiety disorder, etc. and etc. What are the causes of anxiety disorder? The underlying cause of anxiety disorder basically are of three types. Nature-nurture debate we have always been hearing, and many a time people talk about it. Is something is innate in nature or is something learned from the environment? So are we born with these deficiency and that is why some individuals are more prone to develop anxiety disorder, or is it the environment itself is so threatening in nature that it leads towards the anxiety disorder? So when we talk about anxiety disorder, then it could be either the genetic in nature, either environmental in nature, or we have a dysfunctional brain due to early childhood stress, or due to early life stress, due to head injuries, due to traumatic injuries, brain trauma. It could lead towards these are the common causes for the anxiety disorder. So the question is, what is the underlying brain and neural mechanism towards this anxiety disorder, and how we can study anxiety disorder? So we can study anxiety disorder in the laboratory condition using Pavlovian conditioning model, which I will be explaining shortly. And this Pavlovian conditioning model indicates that how fear is being acquired and how pathological memories undergo such modification changes, and what could be the early biomarkers for anxiety and related disorders. So as a researcher, when we do such research in our lab conditions, then we are trying to understand the underlying neural mechanism and how we can modify this circuit, pathological or dysfunctional circuit. And if we can, let's say, if we cannot at least come up with the intervention, effective intervention, then also we should be able to identify anxiety disorder prior hand so that the treatment can become early. The major challenge with the anxiety disorder is that it goes underreported, and this is a big challenge. So let me share with you how do we study conditioning in the lab. Now here what you see, we generally do habituation phase, conditioning phase, and testing phase. Now here you see a rat in a cage. When you see a rat in a cage, the rat is being placed in that context and we do nothing. Now when you do nothing, there will be no threat response from the rat. When you give a shock from the floor we give a shock to the rat, then rat shows a freezing behavior, and this is a threat response towards the shock. But when this shock is being paired with the musical sound, then the coupling happens. So in another condition we present a music also, and when the music is pleasant, rat ignores the music also. So that is something which is not threatening in nature. But when the music is being coupled with the shock, then this becomes a fear coupling, and as a result, mouse, every time he listens to music, he expresses the threat response. That is when we call it as the conditioning, where the mouse is being conditioned with the shock, conditioned to the sound, that every time I listen to music, the shock is being given to me. And then we test how much the rat is showing the fear. So we change this context A to context B, to context C, context D, and every time when we change the context and we present the music, once the rat learns about the threat towards the music, then he is going to express the freezing behavior, which is a fear response or a threat response. This clearly indicates that the rat has learned about the threat. Similarly, this is what happens when a war veteran returns from the war field. Because he's being conditioned to so many stimuli in the war field, that is the war guns, bombings, the loud scream sounds. So when they come to the real world scenario, any such cue may trigger their anxiety or trauma. So there are different other responses are there other than the freezing behavior, such as the blood pressure, heart rate, respiration, and then the release of stress hormone. One such release of stress hormone, we call it as cortisol. Okay, but we cannot do such experiment with humans that we put them in a cage. So what we do, because I do a human study, so what I do in the lab setting is that I bring an individual in the lab, and then I present a colored square on the screen. When I present a colored square on the screen, there is nothing is being paired, so they just slowly ignore the stimulus. So there is no physiological response. Here the physiological response which we take is the electrodermal response, which is a skin response. So there is a change in skin temperature response or temperature when we see the threat, because the change in physiology is happening because for the fight or flight condition. For the fight or flight condition, which is a very primitive response in presence of threat, either you fly from the scene or you will fight in that scene. So energy is required. This energy is being provided in that scenario. The heart pumps the blood very fast so that the blood circulation happens in the entire body part. The necessary part of the body which is require more energy, such as the fist, such as the legs, there we see the high physiological changes. And also in the hands, the sweat glands are being exposed very much, so we can record the skin response from the fingers. So generally the finger is being taken. Now when the blue square is shown and there is nothing happening, then there is no high skin temperature or high skin response is there. However, when this blue square is being paired with an aversive sound, that is a woman's scream, which is chilling, which is shrilling sound, when you hear, it is very aversive in nature. When you hear, then you realize that someone is in pain or someone is in help, requiring help. So that is an aversive sound which makes an individual learn that there is a threat is involved. One. In another scenario, some labs uses electric shock, where they present a colored square and they present an electric shock. That is also aversive in nature. Some people use aversive pictures to pair it. Some people use pressures, manual pressures they give at the time when they are seeing a colored square. Now here, two colored squares could be used. One will be paired with the sound, which every time is coming with the bad sound, and when every time blue square is being presented, a bad sound is presented. There the individual do the coupling and learn that blue square is bad in nature. The other square could be yellow, green, purple, pink, whichever color an individual researcher selects is fine, because throughout the experiment we can randomize the color also among the participant. So in one participant, blue becomes a bad, coming with the sound, while the yellow is not, and in the another participant, yellow can come with the sound and blue is not. So this is how we randomize the color. Acha. Then once this thing is there, every time blue is shown, there will be a huge skin response, which is an indicator that the blue square is threatening. Whenever yellow is shown, then there is no change in the response because it is not coming with the sound. Now we don't want people to leave the lab with this fear, so we perform an extinction training. This extinction training is a new learning or safety learning, and we in psychology we also call it as exposure therapy or flooding, where we present the stimuli again and again and again so that the fear dissipate. There is no fear left behind. which is very good. And then this is a new learning, safety learning, and then the participant ensures that okay, the blue square is now being safe, no more sound is presented. Okay, but the problem arises. The problem arises is that after performing safety learning, after performing exposure therapy or flooding method, fear comes back, fear returns. And this fear which is returning under three basic conditions. What are these three basic conditions? These basic conditions are renewal, reinstatement, or spontaneous recovery. Spontaneous recovery suggests that when a sufficient amount of time has passed, then again abruptly the fear comes back. The reinstatement suggests that when the unconditioned stillness, which means that you are crossing the street and you hear a woman's scream, suddenly the fear comes back. That yes, there is a fear involved, and the person shows a threat response, runs away from the street wildly without thinking, start behaving abnormally. And then the third is the renewal, where the context is involved, where the learning has happened. So if you bring the war veteran to the field, war field, the fear comes back after the successful treatment of trauma. If you bring the war veteran to the therapy center, then also fear may come back, because there the therapy has taken place. Now, under these three basic conditions, fear returns, and then people are looking into different sorts of interventions where they could augment the fear extinction or enhance the flooding or exposure therapy, so that a drug-free paradigm can be proposed. Because till date there is no drug-free paradigm exists. There are a lot of drug-free paradigms are there, but they are not effective enough. In every such paradigm, what we have seen, that the fear comes back. To name few such interventions, music therapy is one, pharmacological method is one, neurostimulation method is one, imagery rescripting is one method, mindfulness is one such method, and etc. and etc. What we have understood is that among all these methodologies, pharmacological method seems to be very effective. However, the drug has its side effect, so we do not know that though we are doing the treatment towards the anxiety disorder, what other comorbid diseases may arise because of such problem. So that is why in our research group, we are looking to some alternative drug-free paradigm. One such paradigm which people have been discussing about was Davy in 1989. He said that can we devalue the unconditioned stimulus, which means that in this case, when a person is hearing a woman's scream sound, bad sound, can we devalue them? Because every stimuli which is present in the environment, we associate some value to it. As we attach value to it, then we give preference to these stimuli in our everyday life. For instance, if we like apple and we don't like banana, then we give more value to the apple rather than to the banana. As a result, when the trauma happens, when the threat happens in the environment, we give more value to the threatening stimuli because of the fight or flight response and because of life and death situation. So when we encounter that threat, we give those threats a very high value. So Davy said that can we devalue those threatening stimuli, and when we do such thing, then we are augmenting the fear extinction or safety learning. So he said that conditioned stimulus is having a cognitive representation of US, and then we can evaluate that unconditioned stimulus which has the aversive and appetitive and painful responses, and then if we are doing the evaluation, then we have to see how the unconditioned stimulus is being experienced alone. So you just present the sound alone, and then let us see how people are responding when more and more they are listening. Then socially and verbally can we attach and associate value to it, such as if we say that the woman is not the woman scream is because woman is excited, woman is feeling thrilled, woman just saw a movie, and that is how. So we are trying to devalue the stimuli here, and then the response attribution process is there, how the response should be attributed in this to this stimuli. And that actually leads towards the evaluation process. Now, when we were talking about such a devaluation, another procedure is the memory reconsolidation process. Why do we have to talk about the memory reconsolidation? One has to understand it, that whenever we are learning about the traumatic events, so these traumatic events pass down to our short-term memory, short-term threat memory, and from the short-term threat memory, which is labile in nature for up to 6 hours, from the short-term memory, when we go to sleep, this information need to be get transferred into the long-term memory. The long-term memory is ensuring and keeping this information for future preferences and reference. So once this long-term memory is there, it is storing it, it get directly connected to the working threat memory. Working threat memory is just ensuring that in the presence of threat or in the combination of threat stimuli, which stimuli I have to give the preference first, and this working memory is involving the cognitive functions such as decision making, reasoning, thinking ability is being involved. Once the consolidation process is done, then the information about the threat remains in our memory system for a long period of time till a cue comes into picture. So working memory, when the cue comes into the picture, when you see the similar threat again in the environment, then this consolidated memory becomes soft again and undergoes into the malleable nature. And once it is becoming malleable in nature, then at this time point we can modify the memory with some update, with some new information. And this some new information which we are updating it, this process can modify the memory with some new information, and the old memory gets overwritten or rewritten with some new information. Now, this process of reconsolidation is only two decades back. What people are proposing with this reconsolidation theory is that this process could be used to modify the pathological memories, and we can rewire the bad circuit with this memory consolidation process. However, one has to know that there are some boundary conditions of memory. What are those boundary conditions of memory? The strength of memory. When the fear memory is very, very strong, then it is going to take more time to get updated. So this, it cannot just happen overnight. It will take more time. One. Secondly, the nature of the stimuli itself. What is the nature of the sound itself, unconditioned stimulus it is, or what is the nature of the context, what is the nature of the conditioned stimulus, and even what is the physiological and genetic composition of the individual is there. So there are several boundary conditions of memory is there. But what we understand with this is that memory can be updated with some new information, and this process could be used to modify the memory. And the brain region involved in the memory reconsolidation process is the frontal cortex, which is the central executive system, which is being involved in the working memory also. So that is why the system becomes highly efficient. Now, when we are talking about such aspect, some of the interventions which we are using to modulate the fear memory in our lab is the music. So we use the music, nature healing music, or classical Beethoven music, or Indian classical music, or ancient classical Indian music. These different music styles we are using to modulate the fear circuitry in the human. And then the imagery reinscripting, which I am going to talk about. Then the cognitive reappraisal, which is a form of emotion regulation also, where people try to regulate it. And then the transcranial direct current stimulation procedure, where people are trying to use the neurostimulation. And then the virtual reality system is also being used. And another intervention is the novelty process, where the novel stimulus is being used to modulate the processes. So let us just talk about the imagery-based intervention procedure and what we have done. So in imagery-based intervention procedure, what we have understood that the normal extinction process is widely implemented interventions and which shows a significant effect in reducing the condition and generalized fear. What we understand still is that though this standard extinction is being performed, still there is a return of fear. So new methods such as imagery-based intervention could be used to augment the efficiency of this extinction training or the safety learning. So how can these processes be used to augment this processes? Imagery rescripting method, what it is the process in which devaluation of cognitive representation of the unconditioned stimulus is happening in a positive direction. So we are trying to devalue the aversive stimuli in a positive direction. Another form of imagery based method is the imaginal extinction. So what is this imaginal extinction method? Where we are using a vivid imagination of the conditioned stimuli during extinction training. So in one process, we are trying to devalue the negative stimuli, while in another imagery based method, we are trying to provide detailed and vivid imagination of the conditioned stimuli. So this way what we are trying to do, we are addressing the CS also, which is a blue square, and also we are addressing the aversive sound, which is a woman's scream. Imagery rescripting is an intervention method of UCS devaluation. Participants in this paradigms are instructed to devalue the cognitive representation of the UCS and modify it in positive manner. This imagery rescripting may create an alternative positively balanced mental representation of the UCS. Once this new representation of UCS is being created, this newly created mental representation is going to compete with the original negatively balanced representation. So we have a new memory, new representation, which is going to compete with the old representation or old memory, which changes the subjective evaluation of the UCS, because now we have a new template which, of the threatening stimuli, which is going to compete. So if we say that there are snakes and snakes are poisonous, however, all snakes are not dangerous and deadly in nature. Water snakes are non-poisonous, water snakes are not deadly at all. So when we devalue such aspect, what we understand is that these changing the subjective evaluation of the UCS through UCS devaluation may result in lowering the conditioned response. The lowering the conditioned response, such as skin conductance response. Once the physiological response has reduced, which means that the alert system of the individuals, which is the amygdala, sends a signal to the body that now you may relax. There is no need to get tense or threatened about anything. So adding this imagery rescripting method to extinction training may be an effective methodology, and it may reduce the UCS expectancy rating, which means that individual may expect less to hear the sound, that a sound will be presented to them during the renewal testing phase, which is the context. So in the same context, what we have understood, extinction was most efficient in reducing the UCS expectancy, because UCS expectancy is an indicator how much threat response an individual is having. This is a subjective response, where an individual is using a Likert scale from 1 to 100 and indicating how much they expected the UCS will be going to be presented to them. So both extension and IMS reduce the negative UCS. Imagery rescripting method reduces the fear potentiated startle responses, reinstatement, indicating the UCS devaluation. So physiological responses are get reduced, subjective responses decreases, behavioral responses get decreases as well. Some studies have also shown that imagery rescripting method plus extinction did not prevent the return of fear through reinstatement. And in addition, some studies have also demonstrated that they do not prevent the return of fear, but also they also not only they prevent the return of fear, but also they show an increased UCS devaluation also. Now, so what we did in this simple study in our lab setting, what we did a simple study where we recruited the participants, and in this after imagery rescripting, there is an imaginal extinction. What is this imaginal extinction? Let us spend some time here. So in this participant is asked to vividly imagine the conditioned stimuli, which is a blue square here, or a spider, or let's say if you are using the snake, and then in the mind's eye you have to vividly imagine that. In imaginal extinction, visualization cues are going to provide an actual presentation of the conditioned stimuli. That cue could be auditory cue, such as I can say, think of a white polar bear. This is a visualization cue where I will ask you vividly now think about a white polar bear and think that this white polar bear is now having a big heart on its belly. So this is, and then I can just ask you to imagine and I can provide you a cue, and then I can ask you to vividly think about that heart or think about the white polar bear in detailed way. What we have seen is that through repeated presentation of the mental imagery of the stimuli CS plus without the UCS, the CS and no CCS association is getting formed, because the new mental representation is getting formed here. In imaginal extinction and in extinction training, standard extinction were observed to produce the comparable result. What we have seen is that they provide the similar result, extinction training and imaginal extinction, not the imagery rescripting. Imagery rescripting is a different imagery based method. Imaginal extinction and standard extinction seems to have a similar response, reducing the fear response. So what we were trying to achieve here is that, is it possible first to conduct such a study, establish the paradigm in an Indian context? So then we can understand this paradigm. Secondly, if we use the reconsolidation process where we present a cue and we make the memory labile, and after making the memory labile, we now update the information with some new information, then we may be able to overcome the threat response. So conditioned fear response acquired through visual presentation, generalized through the mental imagery. Imaginal extinction was an effective as standard extinction in reducing the conditioned fear. High vividness of imagery during the imaginal extinction is not necessary for reducing the fear response. What people realize is that vividness or about the imagery, vividness about the detail of the threatening stimuli do not lower the fear response, but in some cases what we have seen, it actually result in the heightened fear response. It is something like this, that if you are afraid from a snake, and if I ask you to vividly think about the snake, then it is not going to lower the threat response, but it is going to alleviate your fear more when you are thinking in detail about the snake. So when we are talking such aspects, there are certain methodological limitations were there in the previous studies. What were those? Increased cognitive load when imagery rescripting was combined with extinction trial. So what people have done is that they have increased the cognitive load when the imagery rescripting is combined with extinction training. As a result, more cognitive functions are involved. memory, perception, attention, decision making, problem solving. As a result, we do not one could expect that maybe the imagery rescripting could be reduced. Imagery rescripting could become better in stopping the return of fear. Relatedness of the CS with the UCS: if the conditioned stimulus is related to the unconditioned stimulus, then we may face one challenge in reducing the fear. Timing of different experimental phases: what we have seen is that fear acquisition is performed on day 1, fear extinction or safety learning is performed on day 2, and then fear safety is being fear retest is being performed on day 3, where we are talking about the return of fear. Okay, so these are the certain things which people are trying to achieve. Then standardizing the imagery rescripting procedure: somebody is performing an imagery rescripting in India, and somebody is performing imagery rescripting in Germany, and somebody is performing imagery rescripting in America. They may use different methodology, and approaches in imagery rescripting. So what we have to do, we have to standardize it. It has to be a standard, because if things are not standardized, then people in some places people may achieve good results, and in some places people may fail to achieve the results. There is no known study till date where they have addressed the imagery rescripting and imaginal extinction on generalized fear. That in the generalized fear, how the it can be regulated using imagery rescripting and imaginal extinction. There is no such a study available. That is why we started addressing this imagery-based method in our lab. The long-term effects of imagery rescripting and imaginal extinction has also not been explored. So when people are going for therapy sessions, imagery-based methods the therapist is using, but we haven't tested it, how long lasting these effects are, and how long lasting it is there. So let us understand that how this imagery scripting actually works. So how this imagery scripting works: so we show a picture of fire to the individuals, and what we provide them a narrative. This imagery narrative is for the participants to read and understand. This narrative is related to the picture. So what is that narrative? We say that, by the way, this narrative is being standardized by the English native speaker, so that one can assume the meaning, the interpretation is not ambiguous in nature, but it is very clear and simple in nature. So the narrative which we provide to the participants are as follows: you are walking along with your friends, and suddenly you see smoke emanating from the neighborhood. Shocked to see the smoke, you rush towards the place. On the way, you find people running around, and there is chaos everywhere. You reach the place and you find that a building is on the fire. You hear the sound of approaching fire brigade. By this time, the fire has already reached the first floor of the 3-storied building. While the fire brigade is already in operation, a woman comes to the fireman helplessly, saying, "Help me, my child is still inside." One of the firemen assures to help and asks, "Where is your child?" The woman points to the window on the 2nd floor, and to your shock, you see a boy crying for help at the window. One of the firemen shouts, "The staircase is burning. There is no way to reach the top floor." Everyone is frightened and confused about how to save the child. Another man quickly brings a ladder from the fire engine and starts climbing up to reach the 2nd floor. By then, the fire has almost reached the 2nd floor, and there is smoke everywhere. The fireman reaches the 2nd floor hurriedly. He quickly removes the grill window in an attempt to rescue the child. The child is crying helplessly, but he is injured. The fireman takes the child in his arm, climbs down the ladder. He hands the little boy over to his crying mother. The child's mother is still in shock, but is believed. Everyone cheers the fireman for bringing the child back safely. The mother thanks the fireman for saving the child. Now, this detailed narrative we provided to the participants, and they had to read the narrative word by word, slowly and understanding. And then at the end, once they have read the narrative along with the picture, what they are seeing on the screen, we ask them what did they understood, so that we ensure that they understood the scenario. Okay, this is the fear narrative which we provided to the participants. And then what we do after this is that we perform the extinction training, acquisition, which is the fear acquisition. So as I told you earlier, how do we acquire fear in the lab is using a conditioning paradigm, where we use a colored squares, and then we present these colored squares in combination with the sound. Here what we did, here we presented circles of a small circle and a big circle. The small circle in some cases were being paired with the aversive picture, which is the fire. So every time when they see the fire picture, they think of a story that a boy got stuck in the house, mother is crying, fireman has to put an effort, and finally they rescued the boy. That aversiveness is being paired with the small circle. Every time this small circle is presented, the fire picture is being presented to them, not the narrative. Okay, this small circle was being presented to them 8 times, and then after the circle presentation followed by the UCS picture, we ask the participants to give the UCS expectancy, which means that did they expected the UCS is going to be presented to them. Now in some studies you will find that people are using expectancy rating before doing the experimental task, and then the unconditioned stimulus is there, which is the big circle. The generalization trials are where we use the you can see small circles are there of different shapes and sizes, 10 in shapes. So the size changes, and there these small circles are being presented, and the small circle becomes the CS plus, the big circle becomes the CS minus, or the vice versa. And in between the small circles or a range of circles is being presented to them to see to what length, to what stimuli number people are associating fear, and to what stimuli they are not associating to the fear. This is the generalization, just to ensure that to what level the fear has been generalized and to what level people are responding back. Now, we don't want people to leave the lab with the fear, so we perform the extinction training. And this extinction training, what we do, we combine it with the imagery-based scripting. So first what we do, we provide now a safety narrative. This safety narrative says that you are walking along with your friends and suddenly you see smoke emanating from the neighborhood. Shocked to see the smoke, you rush towards the place. On the way you find people running around, there is a chaos everywhere. You reach a place and you find that a building is on fire. You hear the sound of approaching fire brigade. By this time, the fire has already reached the first floor of 3-storied building. While the fire brigade is already in operation, a woman comes to the fireman and says, "Help me, my child needs help." One of the firemen assures to help her. Where is the child? The woman points to the window, 2nd floor, and to your shock, you see a boy crying for help at the window. One of the firemen shouts out, "The staircase is burning, there is no way to reach the top floor." Everyone is frightened, confused about how to save the child. Another man quickly brings a ladder from the fire engine and starts climbing up to reach the 2nd floor. By then, the fire has almost reached the 2nd floor and there is a smoke everywhere. The fireman reaches the 2nd floor hurriedly. He quickly removes the grill window to attempt to rescue the child. The child is crying helplessly, but he is injured. The fireman takes the child in his arm, climbs down to the ladder. He hands the little boy to his crying mother. The child's mother is still in shock but is relieved. Everyone cheers the fireman for bringing the child back safely. The mother thanks the fireman for saving the child. Now, this is another narrative which is being provided to the individual. And in addition to this narrative, the extinction training is being performed, where the individual is now trying to understand that okay, there is a threat involved. However, how one can overcome such type of threat by looking into a different narrative. This narrative is, I think that I have used the same narrative of the fear acquisition, but in the safety narrative, what we say is that the fireman protects the child and stops the fire without spreading the fire to the neighborhood. Mother feels happy, she hugs the fireman being applauded by the people around them. So imagery rescripting, we try to rescript the safety and is being provided to the individual, and then we perform the extinction training where the conditioned stimulus here, small circles and big circles are being presented repeatedly, and now the participant learn that there is nothing to fear about, or both these circles are safe. There is not going to be a fear narrative is there. In imaginal extension, what we say, when we present a small circle, we ask the individual, because this is a small circle in some scenario is the triggering the fear, so we ask the individual to think about it, that this small circle could be a small moon, a small ring, a small circle, and if the large moon is being paired with the unconditioned stimulus, then we talk about large moon, large circle, large ring. So this imaginal extension, they have to vividly think about the moon, they have to close their eyes, and then they have to think about that how the moon is big, and in some scenario how the moon is small or ring, etc. While in another group, that is the standard extinction group, we do not do any such intervention. So such intervention is not being performed, such as vividness of imagination is not there. Vividly, they don't have to imagine it. That is the imaginal extinction, and neither the narrative or imagery rescripting is provided to the individual. This is the normal standard extinction group. What we see in the results, if I just highlight, is that normal habituation is there. There is no change in the habituation condition, sensitization, with acquisition. All the three groups learn equally about the threat. While in the extinction phase, what we see that imagery rescripting group shows less fear compared to the fear they acquired on day 2. And then this clearly indicates that there is no fear at all in the imagery rescripting group. They were successfully able to rescript and rewire their fear. And the indicator was the skin conductance response, which means that there is skin conductance response is a cognitive response, which means that, which indicates that person is calm condition and can think safely that there is no threat involved. While the imaginal extinction and standard extinction have the similar response. This is exactly what we have seen in the previous studies also, that the standard extinction and the imaginal extinction was having the similar response. However, we thought that let us do the testing of, and think about if the fear will come back or not. When will the fear return? And once we have performed this intervention, is it going to be strong enough, robust enough to block the fear? So after 15 days, we invited the participant again to the lab. And once these participants visited the lab again, we presented them with these circles, rings, which were being paired with the fire. Now, if the fear return is there, then while seeing the circle, they will respond, their physiological response will be very high, which means high skin response could be observed, high heart rate variability will be observed, high blood pressure will be there, their breathing will increase, which means hyperventilation will happen if they will see the, there will be a fear return. If there is no fear return, then all the there will be no physiological changes be observed. So what we see, what we observed after 15 days is that participants showed less response in the imagery rescripting group. However, the skin response, the skin physiological response, the skin conductance response seems to be higher in the standard extinction group, and in the imaginary extinction group compared to the day 2 extinction condition. So after 15 days, what we are seeing, imagery rescripting is successfully blocking the fear, while the standard extinction and imaginary extinction seems to fail in blocking the return of fear. Seeing such results, we got very excited, and then we thought that let us look into the ratings or valence rating. So valence rating is the circumplex response which people generally take the subjective response, and on this subjective response there are two scales which people generally use to understand the anxiety and related disorder, that is the arousal scale, which goes from calm to the excited state, and then another scale is the valence scale, which moves from pleasantness to unpleasantness. So if there is no threat involved, if there is no fear return, then people should be rating less unpleasant and high pleasantness on the scale. Well, the fear is returning back, then they should be rating more towards the unpleasantness rather than pleasantness. On the arousal scale, in contrary, when there is no threat present or there is no fear return, then people should rate higher towards the calm state, while if there is a fear return, then they should rate towards the excited state, which is observed. Okay. So this is exactly what we saw in the result also, that on day 15, imagery rescripting differed significantly with the imaginal extinction and with the standard extinction process, which was intriguing to us, that okay, it seems that fear blockage is working with imagery rescripting methodology. So what we so this is the conclusion slide, where what we understood is that the combination of imagery rescripting and extinction process could be highly effective towards the treatment of social anxiety disorder, phobias, etc. Phobias such as cynophobia, claustrophobia, arachnophobia, etc. Imagery reinscripting combined with extinction could be used as a self-help strategy. So individual by themselves can help themselves, and they can use this strategy for individuals at risk of developing anxiety disorder. Those individuals who are more sensitive or prone to develop anxiety disorder, or can have experienced subclinical levels of fear. Imagery rescripting combined with extinction could also be used to treat addiction. Different forms of addiction is there that could be treated with imagery rescripting as well. Finally, imagery rescripting combined with extinction may be highly effective, non-invasive, drug-free, and cost-effective intervention for treating anxiety and related disorder. We do not disagree that this process may take some more time than the usual also. Okay, future direction, what should be doing, what we should be doing in future is to optimize this intervention protocol. We haven't optimized this intervention protocol. We tried to establish this paradigm, we tried to use these narratives to overcome the threat with one single stimuli picture, that is the fire picture. Now in the dynamic environment, in real world scenario, there are thousands and thousands of stimuli we encounter, and any such stimuli can trigger our fear. So we have to at least put more effort towards the optimization of this intervention protocol, step by process, so that a self-care strategy or self-care coping mechanism or system process will be provided to the individual suffering from anxiety and related disorder. Replication with clinical population is another future direction which one has to do, because this study we did it with the healthy young individuals who do not have any form of anxiety, who rated less on low anxiety level on state trait anxiety inventory test developed by Spielberg. So we have to test this thing with the clinical sample and then ensure that its results are still validated. For the validation and for replication, it is important. We have to also integrate virtual reality, because the current scenario, virtual reality could be a robust tool as well. And as I said, imagery scripting, imagination is involved. So virtual reality could offer more beneficial aspects in this regard. Exploring the neural correlates as well. What are the underlying neural mechanism for imagery scripting? How it is distinct from imaginal extinction? How it is distinct from a standard extinction process? What different brain regions are being involved? Can we strengthen those neural circuits so that we can enhance and augment the safety learning, so that we can overcome the anxiety and related disorder? And then enhancement of neurostimulation procedure, because neurostimulation procedure is also a drug, can offer a drug-free paradigm. One. Secondly, the neurostimulation, the stimulation is being done only towards the to the brain. So the electrical or magnetic stimulation do not go to the entire body, unlike the drug which an individual consumes for the anxiety and related disorders. And through the blood-brain barrier, not only it goes into the brain, but also to the other parts of the body and other parts of the organ. With this, I would like to say thank you to Second Life for giving me this wonderful opportunity to share one of my study from one of my students' PhD work, and talk about this imagery scripting method. I'm now open for question and answer if there are any to take this session. Thank you so much once again to entire team of Second Life for giving me this opportunity.
Thank you so much for sharing such voluminous and interesting information. We'll take just a couple minutes for questions, and then we'll move on to our next presenter. Are there any questions?
Yes, can I ask in voice?
Please, yes.
Okay. Hello, Dr. Manish. My name is Maya Takida here. From your conclusion, a combination of imaginary rescripting and extinction could be highly effective for treating social anxiety disorder and phobia, etc. So my question is whether clinical hypnotherapy, combination of these three as well, can be a good treatment. What do you think about it? About clinical hypnotherapy for, for treating social anxiety, because clinical hypnotherapy also use visualizations and triggers and so on. That's it, Doctor. Thank you.
Excellent. Excellent. Thank you for asking this question. I'm not an expert in hypnotherapy, but I have read some papers long back on it, and I think hypnotherapy works with the different neural mechanism is being involved. But what I feel is that in hypnotherapy, the individuals have to undergo into different conscious state, and when the individual is going to different conscious state, then a part of them they do not have a control, which they cannot control. Then there is a gap, uh, there is a gap of information comes into picture, where individual tries, becomes, it becomes challenging for them to understand that how these therapy could work. So when a hypnotherapy works, the therapist generally is being performed by a therapist. They take them to a place where they can feel more comfort and relaxed. However, the real world scenario is filled with a lot of dynamic information. Any cue, any stimuli can trigger that fear. Imagery scripting not trying to take you away from that scenario, but just trying to provide you a narrative, to change your narration about the threatening scenario. And changing the narrative actually gives you more control and brings you more to conscious state, where an individual can come up with coping mechanism and styles. So at the beginning, it might be very difficult to change the narrative to every threatening scenarios. However, once the individual practice this thing regularly, then becomes better and better. Does this answer your question?
Yes, doctor. Thank you so much.
And unfortunately, we have several other excellent questions, but we do need to move on so that we can keep on schedule. So those of you with other questions, if you would like to, I am Dr. Asthana, and he may be able to respond to you individually, but we need to move
I would
on.
be very
So
happy.
thank you very much, Dr. Asthana. Excellent presentation. We really appreciate it.
I would be very happy to answer all the questions. If you can take it and send it to me personally, I would be very happy.